Welcome to this continuing series of videos from the Practice Protection Committee. I'm Pat Bailey, Medical Director for Advocacy in the DC office. We're pleased to welcome back today Dr. Mark Aeder. We're going to speak on the topic of planning for retirement today. And Mark, thanks for being with us.
Thank you, Pat. It's nice to be back here.
So, in some of our conversations, Mark, we've talked about this hypothetical of a surgeon who's, somewhere in their 50s, maybe their early 60s, and based on everything that's gone on in the world, and just the fact of the number of years that they're starting to think about, retirement, what all that may mean for them, and I know there's basically two types of retirement in broad context. There's anticipated and unanticipated.
Yeah, so when we take a look at it, for a surgeon, retirement means stepping out of the operating room. Not doing any more cases, which has a number of implications, of course, financial, professional, and psychological. So when we talk about, let's talk about unanticipated and put that away. Unanticipated illness, injury, some other complicating factor that limits their time in the operating room. That's a whole nother issue we can touch on later. But for the anticipated retirement, it's what you plan for. And the anticipated retirement of stepping back has to be a multi-year process. And you have to have the range, really, because it requires discussions with your family, especially your spouse or your partner. It requires discussions with your partners, any of your professional colleagues, because once you step out of the operating room and step out for a significant amount of time, there's really no going back.
Right. So focusing kind of in on those financial issues, especially related to the fact that it is hard. It's not impossible, but it's hard. It's hard to go backward, put it in reverse. It seems to me that the biggest concern is make sure that when you do that you've got adequate resources going forward to make sure that you're going to be comfortable and in the end not run out of funds before your time is over, if you will. So how do you sort of think that we start having that conversation with ourselves and making those kinds of plans?
Well, I think having adequate funds is really the key. You have a certain lifestyle, you want to continue that lifestyle, you have certain plans and dreams. This is what you and your family have all worked for all these years so that you can enjoy it. If you're stepping out at age, let's say 65, life tables will tell you probably have at least another 20 good years ahead of you to be able to enjoy yourself. You don't want to run out of funds there. And I think it's a good idea to estimate how much money you're going to need in retirement, because that's going to be the key driver as to what you do. We can talk about other things later, kind of planning it out, mapping out what your day is going to look like, what you're going to do to keep yourself busy. But I think it all comes back to have the income stream available to be able to enjoy this.
Right. And so, some of the other exercises that the Practice Protection Committee has gone through, I think, are very analogous and helpful here. We've talked about the quicken perspective and going through and estimating what your monthly outlay is, and the fact that many times, folks are really surprised at what the amount that goes out is.
Exactly. I think one thing retirees will tell you, especially upper income retirees, is they did not anticipate how expensive it was going to be to retire. They thought their expenses would go down. And in the financial industry, you'll have a lot of financial advisors tell you you need 80% of your income. You really need more than that. You underestimate the taxes, you underestimate the living costs, and just the day-to-day things that were occupied by your time in the operating room. So to estimate about what you're going to have your fixed costs that are going to go on through retirement. You're going to have your living expenses, you're going to have your health care, you're going to have every sort of fixed cost that you can imagine to continue. It's your variable costs where you're going to have some flexibility. They may go up. If you want to travel, some of these nice travel programs can be very expensive. And if you really want to enjoy it and do it right, or have some hobbies are expensive, but you've worked hard and you really should plan to enjoy these.
So let's focus in for a few minutes on the assets picture and kind of what when we start thinking about retirement, what we think are the assets that we should count. I know a lot of people think that their most valuable asset is their home, but when we start thinking about retirement, we're still going to live in a home, and so we really need to concentrate on the liquid assets and the retirement funds. What sort of advice do you have? What sort of thoughts do you have about that?
Well, I think we have to back into how much you're going to need and then take a look at your assets. So I think, well, for instance, if you're taking in someplace around anywhere from 250 to 3.25 a year in taxable income, and you want to have at least 100% of that in retirement, remember your home, even if you don't have a mortgage, you're still paying property taxes, upkeep, utilities, everything else that goes on, improvements. So you're going to have all these expenses that are going to continue. If you're looking at, say, $300,000 a year to try to replace, you're going to burn through $1 million in 3 years. Multiply that out to 20 or 25 years. Without any real good plan, that's going to be a lot of cash to go through. So I think what you have to have is a good plan to see where you're going to be. Take a look at what you have in all your retirement funds. 401ks, 403bs, when they're distributed to you, are taxable. And you're going to take out about 3.5% to 4% of your total assets per year from those accounts. If you don't take it out, the government will tax you on it once you reach age 72 at this point. But you're going to have to take those out. What you don't want to do is take out too much and then not have it be able to grow back over the subsequent year. You also have your rainy day fund. You have your investment accounts. Your investment accounts are going to be taxable. If it's not in cash, you're going to have capital gains taxes. You're going to have different things you're going to have to work out. So I think when you start taking a look at what your cash on hand is, you've got to realize that this is taxable and that you're taking out approximately, let's say at most 4% a year from that pool. So that means for every $1 million you have saved and put away, you're taking out $40,000. Now multiply that out. If you want $250,000 a year of taxable income coming back to you, so that's 250 at 40,000 a year, you're going to need a little bit over $6 million saved up. Now that's kind of sticker shock. When you start to roll some of these numbers back, we can look at Social Security. Now, for many of us, Social Security will provide you with $30,000 and $40,000 a year. That takes off maybe $1 million. You may have a pension. You may have had an employer and they had a defined pension for you. That could add a few. You may be been in the military or government work. That's also money that's coming back from you. There's also funds from your business interests and all. So there's ways of getting all this stuff together in terms of trying to put this together. But if we're taking a look at how much money you really need, even just $200,000 a year and using your Social Security is going to require you to have anywhere between $3 and $5 million saved.
Well, I think it's important also to emphasize that before we began talking about this, I was new but didn't really realize all of the complex tax issues that are involved with this. And it just goes back to one of the themes that we've emphasized over and over again about engaging with your tax professional when you do that.
It's real important because you may think your financial advisor helps you build up to what you have in your total wealth account right now. Now is when you really need your financial advisor in order to make sure that the money continues at a pace that you're able to take out an appropriate amount. This is where you need your taxes done well by an accountant and all. If you're going to give charitable funds, you can actually give charitable funds directly out of your retirement account and avoid taxes on that while fulfilling your needs for the government to take out that certain minimum amount that you have saved. So there's all sorts of nuances there. Pat, you're so right that you really need these professionals to do this and to do this with you. You're at a salary point, or you're at an income or wealth point where it's not a matter of having somebody write you the check every month, such as an annuity. This is where you carefully design it so that you have complete control over your finances.
Right. So Mark, thank you very much. We're going to continue this series, delve more into specific topics going forward. And we thank you all for joining us today for this continuing video series from the Practice Protection Committee. Good day.